Hello guys, welcome to SKK classes again. As we have already discussed in our previous video about hyperkalemia, that what it is, what are the main causes of hyperkalemia. So today we are going to discuss about the main signs symptoms of hyperkalemia, that what are the main signs symptoms from where we can judge that this person is having a hyperkalemia. Okay, so let's discuss that symptoms. So hyperkalemia is the elevated potassium level in the blood. When its value is more than 5.2, then we can say the patient is in hyperkalemia. So these are the main signs symptoms. So see in this picture, just to learn about the signs symptoms of hyperkalemia, we are using this word murder, in which the M stands for muscle cramps. Okay, so if the patient is having a hyperkalemia, so he or she will always complain about the muscle cramps or muscle weakness. And next one is your U stands for urine abnormalities. Means if the patient is having a hyperkalemia, okay, here his or her urine production that will be decreased, or he or she will complain having a oligouria or anuria. Now what is oligouria? That is decreased urine output, and anuria means absence of urine, means whether the patient will have no urine or whether he or she is having a less urine production. And third symptom, that is R, stands for respiratory distress. Means that if the patient is having hyperkalemia, he must have a shortness of breath or having difficulty in breathing. Okay, so it may be possible that we have to be put the patient on oxygen therapy. Okay, so and next symptom is D, stands for decreased cardiac contractility. Means the patient's heart activity that will be decreased. Okay, because the hyperkalemia is having a direct effect on the cardiac muscles of the heart, because muscles muscles get weak in the hyperkalemia, and it may be possible that at any time or patient can get a cardiac arrest. And next symptom is E, stands for EKG changes or ECG changes, you can say. Means the patient who is having hyperkalemia and whose potassium level is increased in the blood, his or her ECG must show some ECG changes. And what that changes will be are, now I'm going to show you one picture of ECG that is showing the what are the main sign symptoms will be there in the ECG if the patient is having a hyperkalemia. Now see in this picture, the peaked T waves are there. Peaked T waves means the all of you know that in ECG peak QRST is there. So the T waves are gonna high and very tall in the ECG of the hyperkalemic patient, and your QRS complex that will get wide. Okay, and the PR interval that will be prolonged. So and the P wave that will become flat. So these are the main ECG changes that will always occur in the patient who is having a hyperkalemia or high potassium level in his or her body. And the last symptoms, that is R, stands for reflexes. So what happened in this, the hyper reflexibility will be there, or delayed deep tendon reflex, or means patient reflexes that will be, means patient reflexes can differ, and patient may show hyper like a respiration rate that will be increased, or that heart rate that will increased, and some patient can show like having a paralysis will be there. So these are the main sign symptoms in the hyperkalemia is there, like muscle cramps, urine abnormalities, respiratory distress, decreased cardiac contractility, ECG changes as changes in reflexes. Okay. apart from this, some early signs of hyperkalemia are also there, like heart palpitations, okay, heartbeat irregularities, skin sensation, means a patient can feel tell you that he or she is having a numbness, tingling sensation, burning sensations, muscle weakness, muscle paralysis. And other symptoms includes patient will show sometimes weak pulse, slow heartbeat, or at any time he or she can get cardiac arrest and abdominal cramps, colon blockage, slow reflexes, and sudden collapse of. So these are the sign symptoms of hyperkalemia. I think now you should easily understood that what are the main sign symptoms of hyperkalemia are. So these are the main sign symptoms of hyperkalemia, that what the person will feel if he or she is having a hyperkalemia. Okay, that what are the main sign symptoms, what type of ECG changes will occur in the case of hyperkalemia. In our next video we will discuss about the treatment regarding hyperkalemia, because it's a very vast topic, so we can't cover it in one video. So we will discuss about the treatment of hyperkalemia in our next video. Thank you for watching SKK Classes NZ.